magandang umaga sa lahat, maayong buntag and maupay na aga. So good day everyone and welcome to the 15th session of UP Manila SILab webinar series IOL 2025. So I am Gabby Velasquez and I will be hosting today's session. So at UPM SILab, we are motivated by a strong mission, which is to achieve universal health coverage through digital health capacity building here in the Philippines. That's why this 2025, we're all about empowering our community with knowledge about digital health. That's why we bring our weekly webinar series, the IOL 2025, where we delve into the latest trends and challenges in digital health and interoperability, particularly here in the Philippines. And of course, in case you missed it, we wrapped up three insightful and very productive activities last week. So we had the June 2025 Fire Connectathon, the Immunization Connectathon, and the Fire Masterclass with the founder of HL7 Fire himself, Mr. Graham Reed. So a very heartful appreciation to everyone who joined and supported us and of course contributed to the success of each event. So we're truly very grateful and we look forward to seeing you again at our upcoming events. Okay, so for today, we're bringing you back our weekly IOL webinar series. So thank you all for joining us this morning. We're excited to have an expert on a critical topic about cybersecurity and national health systems. So if you have attended our previous sessions, we already had sessions on cybersecurity for health professionals and health organizations. But as healthcare continues to embrace digital transformation, so there is the urgency to secure sensitive health data. And the question is, why health data? Of course, we learned from the previous sessions, if you recall, it's because the national health databases, they are high value targets because of its volume and sensitivity of the data that it contains. So for today's webinar session, we'll learn about cybersecurity and national health systems. And as always, we are grateful to our partners. So we thank the DOST PCHRD and the CSIRO Australia through the Strengthening Standards Capability Project for supporting our webinar series. Okay. Before we proceed with our session, just a quick rundown of the house rules or reminders for everyone. So this session is already being recorded. And by proceeding with the meeting, you're consenting to be recorded. I request everyone to kindly stay muted throughout the lecture. A virtual background has been provided to your email, so turning on your camera is very much appreciated, especially later during the photo op. So we encourage everyone to please change your name for proper identification and add your affiliation beside your name for proper recognition. And of course, we want this session to be engaging and interactive, so there will be a Q&A session later after the lecture. Please feel free to actively participate and ask your questions using the raise hand function if you want to ask live, or you may type in your questions in the chat box, or if you want to ask anonymously, we have enabled the Q&A button. And lastly, do not forget to receive your electronic certificates of participation. Please complete the evaluation form after this session. And these are just the criteria for the issuance of certificates, so we have provided this in your email. For the community of practice or COP, we're inviting new friends and colleagues to join UPM SILab's community of practice, which is a group of experts and practitioners, all passionate about advancing standards and interoperability in healthcare. So you may sign up to receive our regular newsletter and join our WhatsApp group, or you can scan the QR code on your screen. So please join our group and receive updates from UPM SILab. Everyone is welcome. Okay. 1, 2, 3. All right. So for today's agenda, may I introduce our speaker for this session of IOL 101. So it is my great pleasure to introduce to the group Mr. Ronald Allan Pablo. So Sir Ronald is an independent speaker, lecturer, and subject matter expert on data privacy, information security, governance, risk, and compliance. He is a former data protection officer, risk officer, and information security manager with expertise spanning the BPO, telecommunications, IT, even online gaming, and public sector industries. So in the field of social health insurance, he supported the establishment of PhilHealth's Information Security Department in 2012, working under the leadership of then PhilHealth CIO Dr. Alvin Marcelo, which is UPM SILab's very own convener. So Sir Ronald holds multiple international certifications in data privacy, information security, and AI, and is also a member of the Organization of Data Privacy Professionals. All right, to present the topic on protecting patients in digital age, cybersecurity, and national health systems, join me. Let us virtually welcome Mr. Ronald Allan Pablo. Over to you, Sir Ronald. I'll stop sharing my screen.
Okay, so thank you, Gabby, for that introduction. Can everyone hear me and can everyone see me?
Yes, sir.
Okay,
Can see
so
you and can hear you loud and clear.
okay, so I'll proceed to sharing my screen so we can proceed with the lecture proper. Okay, so can everyone see my screen?
Yes, sir.
So I believe we only have 30 minutes for the lecture proper, so let's get right to it. So before anything else, well, thank you, Gabby, for the introduction earlier. So just some additional information about myself. As I mentioned, I've been an information security and data privacy professional for the past 15 years, and a large chunk of my career has been in government service. I actually spent more than 20 years in the Philippine Health Insurance Corporation. After retiring early from government, I moved to the private sector in a variety of industries. And now I'm basically an independent speaker or consultant on data privacy and information security. And I would like to take this opportunity to thank UPM Manila SILab for inviting me today to speak on cybersecurity and health systems. So the outline of this webinar, we would be focusing on the following subject matters. First, an introduction and context setting, the digital health ecosystem, opportunities and threats. We would be discussing a case study, specifically the PhilHealth ransomware incident, cybersecurity strategies for national health systems, then moving forward, resilience and collaboration. So part one, the convergence of healthcare and digital transformation. Okay, so healthcare is going through a major digital transformation. We're now using real-time data sharing, telemedicine, AI for diagnostics, integrated health records to make care faster, more accurate, easier to access. So it's making the system more connected and efficient overall. But with these benefits, there come serious cybersecurity issues. So health systems are basically attractive targets. Medical and personal data, it's highly valuable. The tech setups, infrastructures becoming more and more complex, and hospitals can't afford downtime. We've already seen ransomware attacks, phishing scams, data breaches in both the public and private sectors here in the Philippines, even across the globe, causing major disruptions and data leaks. So that's why cybersecurity shouldn't be seen as just an IT issue. So I would like to dissuade everyone from the notion that when we talk about cybersecurity, we're talking about strictly a technological problem or an IT problem. It needs to be part of everyday operations. It has to be built into system design, decision making, and how generally staff work. This means doing regular risk assessments, enforcing access controls, having clear plans for handling incidents, and constantly training staff. So, as digital health continues to expand, protecting the privacy, accuracy, and availability of data is essential to keeping healthcare safe, trustworthy, and resilient. So, health data is among the most sensitive types of personal information. It includes not just names, contact details, but also includes diagnosis, treatment histories, potentially genetic information, mental health records, and because of its depth and value, it's a common target for cybercriminals, often used in fraud, extortion, identity theft, possibly even blackmail. That is why health systems around the world, including here in the Philippines, have become frequent targets of cyber attacks. Hackers aren't just after the data, they're also taking advantage of fragmented security setups and the fact that healthcare services can't afford downtime. That's why we have a lot of ransomware attacks in the healthcare sector. In ransomware attacks in particular have caused serious disruptions, leaked patient data, and shaken public trust. So as healthcare becomes more and more digital with electronic records, remote consultations, and now artificial intelligence tools, there's a growing need to pair innovation with strong security. So ultimately, people will only trust digital health systems if they're confident that their personal information or that their sensitive personal information is safe. So that is why cybersecurity isn't just an IT issue. I can't keep stressing that enough. It's a core part of delivering reliable and secure healthcare. So trust in healthcare relies heavily on how well data is protected. People expect their personal medical information to stay relevant, stay private, stay accurate, stay accessible when needed. So that is what we mean by confidentiality, integrity, and availability, which are the three core principles of information security. I'm sure you heard this triad before. So confidentiality, you have to make sure that information is only accessible to those who are authorized to access that information. Integrity, the information should be correct, up to date, accurate, and should not be tampered with. And availability, that information should be available for your use whenever you need it. Cyber resilience is about making sure that these three principles are maintained, even when systems are under attack or facing technical issues. So in healthcare, this is especially critical. If a hospital systems go down because of a cyber attack, it can delay treatments, disrupt lab results, even prevent access to medical care, endangering patient safety. And when a data breach happens, whether it's stolen records or ransomware, it's not just a technical problem. It can seriously damage public trust. Patients may hesitate to share information or avoid digital services altogether if they're unsure that their data is safe. So ultimately, strong cybersecurity and resilience planning is not just about protecting systems. It's also about making sure that care can continue safely and consistently, even during unexpected disruptions. So part two, opportunities and threats in digital health. So healthcare is going digital, and it's going digital at a rapid rate. There are tools like electronic health records, telemedicine, cloud storage, and AI-powered diagnostics. AI-powered diagnostics. These technologies are no longer actually experimental. They are now often a regular part of how care is delivered. These technologies help make healthcare more accessible, more efficient, and more accurate. For example, electronic health records give doctors real-time access to patient data, making coordination among different healthcare institutions and healthcare providers easier. Telemedicine helps people get care even in remote areas, well, as long as you have internet access. Cloud platforms allow faster data sharing across facilities, again, as long as you have good network connectivity. And AI is now being used to support diagnostics and early detection. But as more and more systems get connected, cybersecurity risks go up. Basically, your attack surface is increasing. Every new tool opens the door to potential cyber attacks. And in healthcare, a data breach isn't just about lost information. It can delay treatment, expose private data, and as mentioned, it can even put lives at risk. So that's why cybersecurity needs to be built in from the very beginning or from the very start. It should not be treated as an afterthought. Controls at the organizational, technical, and physical level should be part of the system design. And these must align with standards like ISO 27001, ISO 27799, and even national health, e-health guidelines. As we rely more on digital health tools, securing these systems is the key to keeping care safe, reliable, and trusted. So the threat landscape in healthcare. So healthcare has become one of the most targeted areas for cyber attacks worldwide. So as hospitals and public health agencies move more of their operations online or under the cloud, they're also opening up more and more ways for attackers to get in. Ransomware is one of the most serious threats. So case in point, the 2023 PhilHealth breach is a clear example. Just one attack shut down key systems, it delayed claims processing, it exposed sensitive personal information. And when that happens, it's not just an IT issue again. It affects patient care, it damages public trust. There's also phishing and social engineering, which are quite common. I've been in a number of organizations, and these have become basically the bread and butter of data breaches. These are so common, whether you receive them through email, through text messages, and so on. These rely on tricking people, usually through fake messages, like through emails or text messages. And all it takes is just one person clicking on the wrong link, and the entire system can be compromised. There are also risks within the organization, insider threats. Whether it's accidental or intentional, things like unauthorized access or mishandling of patient data can cause just as much harm. So, on top of that, many healthcare providers work with outside vendors for things like IT support, diagnostics, cloud services, or just outsourcing of processing of personal information. So, if just one of those vendors has weak security, it can put the entire system or the whole system at risk. Newer threats are also emerging. There are hackers targeting old, outdated systems. And now there are deepfakes, which can actually impersonate doctors, patients, medical records, or exploit vulnerabilities in connected medical devices. So, given how quickly these risks are evolving, healthcare organizations really need to continuously strengthen their cybersecurity. So, that includes regular risk assessments, layered security measures, sharing threat intelligence, and constantly improving defenses to keep patient data safe and services running smoothly. So the value of health data. So why is health data high value? So health data is considered one of the most valuable types of personal information out there. On the dark web, it can sell for 10 to 20 times more than credit card information. That's because it's not just basic information. It includes insurance details, can include diagnosis, lab results, medications, entire treatment histories. It's detailed and long lasting, which makes it useful for things like identity theft, insurance fraud, and even extortion. But the impact of a breach goes way beyond just privacy concerns. First and foremost, you have to consider patient safety. If a cyber attack locks doctors out of records or alters important data, such as allergy information, medication history, if these are missing, patients are put at real risk. Second, data integrity matters. Health professionals depend on accurate information to make split-second decisions. If records are tampered with, even if it's not deliberate, even if it's by mistake, it can lead to misdiagnosis, wrong prescriptions, and again, threaten the safety of the patients, in addition to concerns about errors in billing and reporting. Then there's the issue of operations. A cyber incident like ransomware can shut down admissions, delay surgeries, interrupt lab work. So that kind of downtime can have immediate consequences for patient care. And lastly, there's the reputational risk. Once a healthcare provider suffers a breach, public trust takes a hit. Patients may be less willing to share sensitive information or use digital services, which can affect the use of some digital health programs long term. So if you think about it, this is a real issue about maintaining trust in health systems or information systems in general. I'm sure everyone recalls the major breaches which happened in the Philippines. For example, in 2016, the Comelec incident, and just 2 years ago with regard to the PhilHealth ransomware incident. And trust does not quickly return because of incidents like that. And sometimes for some people, it takes a very long time. So while protecting health data, it's a legal requirement. It's also critical to ensure that keeping healthcare systems safe, reliable, and trusted is a priority as well. So let's discuss briefly case study, the PhilHealth ransomware incident. So one of the most significant cybersecurities in recent Philippine history is the Philippine health, particularly in the Philippine health sector, is the one which involved the Philippine Health Insurance Corporation on September 2023, when it was targeted by the Medusa ransomware group. So the attackers gained access to internal systems, they extracted sensitive files, and issued a ransom demand of 300,000 US dollars. This breach led to widespread disruption. Core digital platforms such as the e-claim system were rendered inoperable. affected reimbursement processes and benefit validation for healthcare providers and members nationwide. So this resulted in fallback to manual operations, resulting in service delays and administrative bottlenecks. So the leaked data reportedly consisted of scanned government-issued IDs, employee records, and various other health-related documents. So although the integrity of the main membership database was not officially confirmed as compromised, so the breach highlighted serious vulnerabilities in data protection and serious oversight and system oversight. So the National Privacy Commission initiated a formal investigation. So during the inquiry, PhilHealth officials confirmed that the antivirus protections at the time were already outdated. So it amounted to an admission of basic cybersecurity control deficiencies and possibly broader IT governance concerns. So this incident serves as a case study on the consequences of inadequate cybersecurity posture in the public sector beyond the regulatory implications. So the PhilHealth breach emphasized three critical dimensions. First one, the operational risk to public service continuity, the exposure of personal and medical data, and the erosion of institutional trust. So it underlines the importance of treating cybersecurity as a strategic priority, particularly for agencies that manage sensitive personal information. Okay, so there were a number of major factors which contributed to the data breach. It was not solely a result of technical shortcomings, so it reflected broader failures in governance and risk management. So again, we're discussing the topic of cybersecurity, but I'm not sure for the nth time, it has to be stressed that cybersecurity is not just focusing on the technological component of security. That is only one very small portion of it. It really doesn't matter if you invest millions in cybersecurity tools if you do not have the appropriate frameworks for deploying those tools, for managing those tools, for governing how those tools are implemented. So one key issue was the expiration of the antivirus software due to procurement delays. So for a period, endpoint defenses were inactive, leaving systems exposed without alternative controls. So it's an elementary lapse in basic cyber hygiene and risk community. I mean, a lot of us have mobile phones, we have laptops. We would be quite paranoid if a mere laptop, if a mere mobile phone may not have endpoint security. So how more for a health system which handles personal information of potentially millions of data subjects? Another factor was the continued use of unpatched legacy systems. These systems, known to contain exploitable vulnerabilities, were retained despite the risks, often due to cost or compatibility concerns. So these gaps provided attackers with an easy foothold. So one thing which is not often realized by most people is that it seems common sense or counterintuitive that if there is an update or a patch for any operating system for any application, that patch should be updated immediately. But the thing is, in larger corporations, there are significant delays in deploying these updates or patches because first and foremost, you have to test if that patch is compatible with your existing infrastructure, with your existing software. It is not unheard of for systems to stop working because of a patch, because of a deployed patch. So you have to test them. Another is that updates and patches can affect performance of the infrastructure, performance of the system. But if you rely on these excuses so much to the point that you fail to install those update patches and security updates to the point that you're leaving gaping holes in your infrastructure, then there's really a problem in your organization. So additionally, the network architecture lacked segmentation. So with a flat network, once attackers gain access, they were able to move laterally across systems without encountering logical barriers. So this design flaw amplified the impact of the breach. So compounding the issue was the absence of a robust backup and recovery capabilities. Reports indicated that some backups were outdated or untested, and during the incident, system restoration was delayed and incomplete, so requiring a fallback to manual operations, causing extended service disruption. So if you have adequate backups for your system, even if there's a major breach which leads to your system collapsing or falling down, If you have good backup policies and procedures, you can just implement the backup again and proceed with operations as normal. In this case, because of the lack of robust backup and recovery measures, there was delays in getting the system up and running again, which lasted a number of days. So, what can be most critical in this event? So, most critically, the incident revealed a breakdown in governance. So, let's not focus on the technical aspect because there is that. There was apparently inadequate executive oversight, no continuous security monitoring in place, and weak internal audit engagement. The lack of coordination across the three lines of defense allowed individual control lapses to escalate into a full-blown systemic risk. If you can imagine, the expiration of antivirus or endpoint security is really a major risk, and it should have been caught by the different levels of defense if your governance structure is robust enough. And apparently, in this case, it wasn't. So again, this breach underscores that cybersecurity is not just a technical function. It must be integrated into enterprise risk governance. There should be active leadership engagement, routine control validation, and clear accountability across all levels of the organization. So part 4, cybersecurity strategies for health systems. So again, because we're talking cybersecurity, a lot of you may assume that we are going to talk firewalls, we're going to talk intrusion detection systems, endpoint security, XDR, EDR, a lot of those technical acronyms. But to be perfectly honest, those technical solutions are actually one small part of cybersecurity. So integrating governance, controls, and risk oversight is essential to building a resilient digital health system. So at the core of this is the three lines of defense model. Building a resilient digital health system requires integrated governance, controls, and risk oversight. So the three lines of defense model defines clear roles from operations to compliance to audit, and the safeguards must span organizational, technical, and physical domains. And those domains should be tailored to each system. So you cannot implement cybersecurity controls out of a checkbox. They have to be based on a comprehensive security risk assessment so you can put in the controls which are actually necessary for your infrastructure. Strong data governance ensures health data is classified, accessed, and protected in line with privacy laws and business needs. So vendors must meet the same standards through robust third-party risk management. So a lot of us, we only engage in risk management when it comes to our internal systems, but not when it comes to third parties. And critically, all of this must be supported by a culture of security, either through staff awareness, regular drills, leadership accountability. So again, security must be built in and not bolted on. So briefly, this is a slide of the three lines of defense model. This is an easy way to understand how risk management is organized, especially in cybersecurity and particularly in healthcare cybersecurity. So the first line is operations. This can consist of your IT staff, doctors, and employees who use systems and handle data every day. So they're the ones applying controls where the actual work happens. The second line is support and oversight. There are different teams for this. This includes risk management, your legal compliance teams, your data privacy teams, your information security teams. They don't necessarily run the systems, but they set the rules and check if everything is being followed. Then the third line is internal audit. They take a step back and independently check if the first two lines are doing their jobs right. The reports go to top management and to the board. So this model only works if everyone understands their role and leadership follows through. So when it breaks down, say outdated antivirus software or weak oversight, small issues can turn into serious incidents. So the bottom line is that cybersecurity isn't an IT issue. It's a shared responsibility across the whole organization. So if you think about it, if these three lines of defenses are implemented properly, it would be very difficult for a risk to go through all of these defenses unnoticed and unmanaged. So if a major risk, like for example, if you do not have antivirus protection, does not goes through all of these, three lines of defenses and remains unmanaged, there's really a problem with your organization. So the three ISMS control categories. So this slide breaks down the three main types of information security controls. These are organizational, technical, and physical. So together they form the backbone of any solid security framework, particularly in ISO 27001 under the ISMS standard. So organizational controls are all about governance, things like policies, assigned roles, training, how your team responds to incidents. They set the rules and responsibilities. So technical controls involve the actual system. So we're talking about passwords, access control, firewalls, encryption, antivirus, multi-factor authentication, and a lot more. So these are your digital defenses, but they only work if properly configured and maintained. Again, if you're talking about an antivirus system, if it doesn't have up-to-date antivirus signatures, and with malicious software evolving at the rate it is nowadays, it's almost as if you do not have any protection at all. Physical controls also protect your hardware and facilities. You have to think locked server rooms, your closed-circuit television cameras, biometric access, even backup generators if there are power outages. They keep unauthorized people from physically accessing sensitive data and keep your systems up and running. So I'm reminded several years ago when I was still in PhilHealth, part of physical controls also takes into consideration disaster recovery and weather. Because, for example, during the Yolanda typhoon, we had a lot of offices, well, not a lot of offices, those in the typhoon areas in which a lot of the IT resources were actually flooded and rendered inoperable. So you also need controls to ensure protection against the elements or against acts of God. So each control type tackles a different risk. So you can't have the best software. You can have the best software rather, but it won't help you if your servers are exposed or staff aren't trained. So that's why all three need to work together, particularly in high-risk environments such as healthcare. So next slide. This slide shows a simple way to classify healthcare data into four types. So you have patient data, clinical data, administrative data, and research data. This helps us apply the right protections because different kinds of data do not necessarily have to be protected the same way. This classification, if I'm not mistaken, it follows standards like ISO 18308, ISO 27799, and even guidelines from the OECD. So patient data can include things like the patient's name, medical history, and application data. In the Philippines, this is considered sensitive personal information, so it needs strong protection. Clinical data comes from actual treatment, so lab results, prescriptions, notes. So this overlaps to a certain degree with patient data, but even small errors here can have an impact on patient safety. So again, accuracy is critical. Administrative data covers HR records, billing, schedules. So not necessarily data relating to the patient. You can call it routine data, but it often includes personal and financial information, which can be a target for fraud. Research data involves studies, genetic information, public healthcare data. And even if it's anonymized, you still have to be wary that there is still possibly a risk of re-identification. So ethical review and strict data sharing rules are also essential. So making these kinds of data classifications helps manage risks throughout the data lifecycle, from access to storage to breach response. So again, I'm sure you've seen this slide before. So this highlights the 5 pillars of data privacy accountability from the National Privacy Commission. So I'm sure you've attended webinars before focusing on data privacy, but so we won't really focus on these pillars in detail. But for purposes of refreshing your memory and for purposes of aligning this with the compliance requirements in national e-health systems, you have to make sure that your organization complies with all of this. You have to appoint a data protection officer. You should know your risks. You should do PIAs in order for you to determine your personal information risks. You should have a plan. So you should document your privacy management program. You should have a privacy manual which lays out that plan. You should be accountable by implementing this plan. So it doesn't really matter if you have a plan, but if you're not implementing it, it's just a compliance document. It's just a paper document which is not being implemented. And lastly, you have to be prepared for a breach. So your organization needs to know what to do in case there's a data breach. So you have to make sure that you have defined procedures. You have to test how these procedures are implemented. You have to be wary of reporting procedures because there are certain circumstances that the law requires notification within 72 hours following a data breach. So whenever you manage your organization's data privacy risks, or when you deal with risks involving third parties, you have to ask yourself, does your organization or does the third party follow these 5 pillars of data privacy, accountability, and compliance? So this slide covers the basics of third-party risk management. So when working with vendors or service providers, you have to assess risk. So what kind of data or systems will they be accessing? Will they be handling personal, sensitive, or critical information? In which case, you need stronger controls and closer oversight. Next, you have to do your due diligence. You have to check how well they protect data. You have to look at their cybersecurity procedures. You have to check past breaches, financial stability, and whether they comply with the law. So again, you have to determine, are they registered with the National Privacy Commission? Do they have DPOs? Do they have a privacy management program? Do they do privacy impact assessments, and so on and so forth? So you're not just checking if they're capable, you're checking if they're trustworthy. So again, trust is a very important factor when dealing with third parties. Contracts are also key. You should spell out key data protection terms, data breach notification timelines, your right to audit, how data should be deleted when the contract is over with, limits and subcontracting, because they may subcontract data to further third parties, and what happens when the partnership ends. And all of this should align with NPC rules and relevant government regulations. Once the third party is on board, the work doesn't stop there. You need to monitor them, conduct regular reviews, limit access where needed, and reassess their performance over time. So a lot of first parties, a lot of organizations, once they enter into a contract, they neglect this. They don't do third-party monitoring. And a lot of times, the frequency is actually quite increasing, that the security risks or the data privacy risks are with the third party because they are not being supervised if they're following the terms provided in the contracts involved. And if there's a breach, there should be a clear plan. Know who gets to be notified, when and how you'll coordinate. This is especially important when engaging third parties. And this should be defined also in your third-party contracts. Particularly, if you take into consideration the requirement for NPC guidelines for breaches to be reported within 72 hours. In short, third-party risk management isn't just good practice. So it's a governance requirement. It helps protect your organization from legal, organizational, reputational risks when relying on external partners. So we're getting to the last few slides. Building a culture of data protection. So this slide is about building a strong culture of data protection. So it doesn't really matter if you have all of the tools, if you have all of the policies, but if your organization doesn't have the culture for it, all of those things will come to naught. This is something that goes hand in hand with your technical and your organizational security controls. First, we have to talk about training. So most data breaches happen because of simple human error. We can't discount the fact that the individual still remains a huge factor for information security and data breaches. So that's why it's important for employees to regularly receive training that's tailored to their roles. Everyone should understand what personal data is, how to protect it, and the things that should be avoided. So this training should not be treated as a one-time thing. It has to be ongoing and updated as new threats come up. So under our laws, especially the Data Privacy Act and guidance from the National Privacy Commission, actually training isn't optional. It's considered a core part of how an organization stays accountable. But yet be surprised that a lot of organizations, a lot of their ordinary employees still don't have data privacy training. This kind of training helps employees recognize phishing, helps them respond to data breaches properly and follow good privacy practices. But training alone isn't important. You have to keep privacy top of mind through regular reminders, posters, quick tips, digital updates, even simulated attacks. So this is especially important for remote or hybrid setups. Then a real privacy culture means people feel safe to speak up. Employees should be encouraged to report anything suspicious, and leaders need to set the tone by walking the talk and supporting, not blaming those who raise concerns. So I've been in organizations before in which if you raise something, it becomes your problem, or becomes you're blamed for that problem because you're the one who brought it up. So those kinds of toxic cultures are not conducive to data protection and information security. So to summarize, a strong privacy culture takes time. So these kinds of culture changes, you cannot do this overnight. But it's built through regular training, consistent reminders, and a work environment where everyone plays a role in protecting data. So part 5, moving forward, culture and capability building. So this slide outlines 4 key enablers for strengthening cybersecurity in the Philippine digital health sector, with emphasis on governance, coordination, and continuous development. First of all, there should be a national cyber health resilience roadmap. A unified strategy is needed specifically for health to standardize baseline cybersecurity capabilities across healthcare institutions. So this includes defining roles, response protocols, and alignment with national initiatives such as the DICT's National Cybersecurity Plan and the Department of Health's Health Facility Development Plan. There should be public and private and multi-stakeholder collaboration. So cybersecurity risks in healthcare extend beyond a single institution. Effective management requires collaboration between the government, the private health providers, technology providers, even regulators. So this may include shared infrastructure investments, information sharing, and coordinated incident response. Then you have to have security by design and privacy by default. I think these are explained in the Data Privacy Act and various literature involving data privacy. So these principles ensure that security controls are integrated from system development through deployment. This includes default encryption, role-based access, data minimization, system logging. So compliance should align with local data protection requirements under the Data Privacy Act 2012 and international frameworks such as ISO 2779. So the problem or the dangers with not being able to implement privacy by design, privacy by default, is that you end up integrating security and privacy controls at the tail end of the implementation. And to be perfectly honest, usually by then it's too late. But again, those are the challenges when it comes, particularly in the private sector, where a lot of decisions are politically driven. So if there is a political requirement to deploy a particular system, more often than not, the privacy concerns, the information security concerns take a back seat to prioritizing the operationalization of that system. And if we keep operating under that kind of paradigm, we are really in danger of deploying a lot of insecure systems. So there should also be continuous improvement in threat intelligence sharing. Healthcare organizations must adopt regular testing of controls like penetration testing, tabletop exercise, third-party audits, and analyze breach trends to adjust defenses. A lot of organizations, they just do their capex. They just buy those security systems, deploy them, and call them a day. But the thing is, cybersecurity threats are constantly evolving, and with the prevalence nowadays of artificial intelligence, the threats are increasing at an exponential rate. For example, black hat hackers can actually use AI to develop malicious code or malicious software. So we have to be really wary of that. So cyber resilience in healthcare requires more than just technical tools. It involves continuous planning, sector-wide collaboration, embedded security practices, and continuous adaptation, all anchored on strong governance. So again, I would like to finish off my discussion that when we talk about cybersecurity, it's not just about technology or not about information tools. It all has to be anchored on strong governance. So with that, I conclude my talk. So, Gabby, can we move forward?
Yes, sir. Thank you so much, Sir Ronald, for that very enlightening talk. So today we gained valuable insights on the opportunities and threats of digital health ecosystem, the classification of healthcare data. He also mentioned the three lines of defenses and the components of a third-party risk management framework. And of course, we must remember that cybersecurity is not just an IT issue, and a strong data privacy culture takes time. So again, thank you so much, sir, for that very informative lecture. We're now opening the floor for Q&A. So do we have any questions from the group? Again, you have three options. You can use the raise hand function if you want to ask your questions live, or you may chat your questions in the chat box. And lastly, if you want to ask anonymously, you can use the Q&A button. Okay. So, sir, I think here we have questions already in the chat. Let me just read it for you. It's from Dr. Alvin Marcelo. So, on resilience roadmap, are there ongoing organized efforts toward this?
If I'm not mistaken, I think there are some discussions, particularly in the health sector, and particularly if we cover the discussions um, taking place between NGOs, between different government agencies. But the thing is, at this point in time, we do not yet have a unified playbook when it comes to this. So the risk for this is that a lot of different organizations tend to implement cybersecurity in inconsistent ways, which makes them more difficult to makes it more difficult to establish standards, makes it more difficult to audit or determine their effectiveness, and more difficult to set a clear standard across different implementers of these frameworks. So it really helps if we have a unified standard to apply to all.
Yes, sir. Thank you. And oh, wait, hold on. Let me just read the chat. Yes, Dr. Alvin mentioned a unified playbook will be useful. So NIST, or is this NIST doc, has these documents already, and maybe we can start with those. So the key is community of practice. Okay, so sir, here we have another question from South Cotabato, Sir J.L. Dalisay. So most of our public health facilities, especially at barangay level, are vulnerable due to limited equipment and infrastructure. So in a healthcare provider network po, how can we realistically set and enforce minimum cybersecurity standards across all partners, so including the HS providers po, without overwhelming the smaller or resource constrained facility?
Okay, so one way to approach this is that we know that at the grassroots level, a lot of organizations, a lot of LGUs may not have the infrastructure, may not have the resources in order to deploy cybersecurity controls. So we are talking about electronic health systems. So technically, those can be centralized. Those can be centralized. Those can be secured using industry standards. We have various standards like ISO 27001, so that the focus, the burden on securing those systems can be with the organizations which have the resources to do it. As for training, there are many opportunities for providing those trainings either online, like what we're doing right now. For the technical side, we cannot and should not expect small organizations or local government units to do the necessary investments. So that's why we are trying to avoid the siloed approach when it comes to electronic health, to try to do it in a centralized manner that's easy to secure, that the best of the best when it comes to cybersecurity and when it comes to governance, we can apply those methods of thinking to that particular centralized approach, so we can lessen the burden of those at the tail end. For example, those at the operational side, those at the LGU side. The LGU side, we can focus on providing regular training, but then again, that's not the most difficult part when it comes to cybersecurity.
Thank you,
I,
sir. And yes po, I also po agree po, especially na infrastructure pa lang itself mahirap na in the barangay level or yung sa mga nasa maliliit na
well,
settings. Okay,
just
so
to add to that, as I mentioned, I
yes,
worked
sige.
before in PhilHealth. For the longest time, that has always been the argument that the infrastructure is lacking, especially in far-flung provinces, far-flung regions. But since then, since the decade that has passed, nowadays everyone has mobile phones. There's almost all of the locations are covered. A lot of locations actually are covered by network connectivity. So at least there's that. We do not have to worry about. Usually, we have to worry about installing leased lines, about network connectivity to the far-flung regions here in the Philippines. But for every area that has network coverage for the major providers, at least the infrastructure already has roots to grow because you can already connect to other parties within the electronic health infrastructure. So just to add to that. Ms.
Yes, sir.
Gabby?
Thank you po. And a follow-up question from Sir JL also. So interoperability is all about openness and sharing data, but cybersecurity is about restricting and protecting access. So how do we find the sweet spot between the two, especially in a healthcare setting where both patient safety and privacy are critical?
Well, I think there is a misnomer that cybersecurity is all about preventing access to data. Well, in a sense, that is correct. But as long as, for example, we apply the Data Privacy Act, if what we are doing is considered a legitimate purpose, if it is based on, let's say, a law, let's say if it is based on public interest, if it's based on national interest, if we're protecting the welfare of citizens, that can easily be justified as a use case for data sharing. Now, once the purpose has been established, the legitimate purpose has been established, that is where cybersecurity comes in. Cybersecurity will not go from the very beginning and say, you cannot do this, you cannot do that. It will look at the use case, then recommend ways in either to secure that. So it's not really a balance, securing a balance per se. It's about doing what we need to do to ensure public health in general, then implementing the appropriate organizational, technical, and physical measures to ensure that that processing of data is safe. So cybersecurity in this case is support to the function. It will not define the function. Yes, Gabby?
Thank you, sir. Yes, yes po. Yes, sir, I agree. And here, sir, there is a question on data protection officer. So, in a city aiming for a digital transformation, it is not only health data that is suddenly thrust into digital space, but other related data as well, like on civil registry and social services. And the law mandates a DPO for the city. However, often LGUs are not capacitated to actively think about security in data governance and even in hiring capable individuals. And what should our DPO prioritize in this context?
Well, to be perfectly honest, that phenomenon is not just limited to LGUs. It's actually prevalent everywhere. I encounter a lot of data protection officers who are either undertrained, inexperienced, or they're understaffed, undersupported. So if you think about it in that way, it seems like an insurmountable task. Now, there are a lot of data protection officer trainings nowadays, varying quality. Some are good, some are mid-pack. But the important thing is for DPOs basically to understand what they're doing. The main risk when it comes to DPOs nowadays is that a lot of DPOs are not actually aware of what needs to be done. So the first basic rule is that you have to look at two things. One is compliance, and one is ensuring data protection. So when you look at compliance, I mentioned this before, the 5 pillars, you have to have a designated DPO, you should do a privacy manual, you should do privacy impact assessments, you should implement technical matter, technical controls or governance controls, and that you should have breach reporting procedures. Now, it sounds difficult, and to be perfectly honest, it is, because there was one time I was a DPO in a certain organization, and I was doing so I was a DPO in my sole capacity. I did not have staff. And it took me almost a year to get all of that done. So the important thing for you is to focus on the guidelines provided by the National Privacy Commission and report directly to management. You we should do our due diligence, but it's not safe to say that DPOs are miracle workers. We have limited resources, we have limited time, we have limited expertise. So as long as you keep doing your due diligence and keep informing management of the situation that you are facing, and that say that we need these things in order to accomplish this, as long that you are doing your due diligence, you should be fine as a DPO. But being fine as a DPO is different from the organization itself being safe from data breaches. So the best thing that you can do is be informed, and once you understand what the job entails, you should also inform your management as a form of due diligence, so they know what they should do. Gabby?
Yes, sir. Thank you po. And I think that answers also the other question related to the DPO. So what should DPOs do next if their organization is large like PhilHealth or DOH?
Can
It
you
encompasses naman na, sir, no,
Gabby, I think
ano,
I'm losing you. Can you
that
repeat the question?
explanation. Oh,
Hello?
apologies. Okay. So
Can you repeat?
hello, can you hear me,
Yes.
sir?
Yes, I can hear you.
Am I audible now?
Yes.
Okay. So here, sir, the Data Privacy Act mandates the appointment of the DPO. So what should DPOs do next if their organization is large like PhilHealth or DOH? So I think that was covered already in the previous question. Tama, sir, diba? Or do you want to
Well,
add something po?
well,
If
just
the
to add to
DPO,
that, if you are a new DPO, so first and foremost, a lot of those initial tasks they can be done during the registration process with the NPC. That is assuming that your organization hasn't been registered before. Because during the registration, that includes the inventory of your processing activities. So it's like basically art of war. You have to be familiar with the area that you are protecting. So as a DPO, you should be aware of your various data processing systems, all of your systems which involve processing of personal information. You should be aware of and take it from there. Because once you are at least aware of this of your scope, you can start coming up with your privacy impact assessments, determine what needs to be done, determine if you need organizational controls, policy controls, if you need technical controls, and so on and so forth. So know what you are protecting first before you move. Because a lot of people, I've seen people in information security and data privacy before, they start purchasing security tools, they start purchasing, they start coming out with policies without knowing if these policies or tools are actually based on the actual risks. So know the area that you're protecting. So that's a simple way of putting it. Gabby? Hello, Gabby.
Ronald, for that. So here's a question for EMRs providing services as an information system provider. Who do we notify during breaches? And their subscribers only are subscribers only in clinic admins. Do we include their patients as well?
Let's start with the first part of the
So who
question.
do EMR providers notify?
Okay, so the first EMRs, you are personal information processors. So basically, well, this actually would depend on the nature of your contract with the personal information controller. But generally, you should inform the personal information controller immediately, because they are the ones who are in charge of the collection and use of the personal information, and they subcontracted part of that process to the personal information processor, or to the EMR institution. So you should first report as soon as possible to the personal information controller. So that personal information controller can come up with a decision whether that breach falls under the mandatory 72-hour notification period. You have to take into consideration that the 72-hour period comes or counts from the time the breach is detected from the PIP, because essentially the PIP is the extension of the PIC. So you should not dilly-dally and wait for several days before you inform the PIC. You should inform the PIC as soon as possible. The second part of the question is, can you repeat that, Ms. Gabby, because I didn't get that? Ms. Gabby?
Sir, I think
Yes.
I'm asking the question.
Okay.
That I think you already answered the question, because I'm asking if we only notify our subscribers as EMRs, or including their patients also as well.
Including the patients, basically you should, when we talk about the mandatory notification, it's not just within 72 hours. It's not just informing the National Privacy Commission. It also includes the informing the data subjects concerned. Now, as the EMR, you are the personal information processor. It is the personal information controller which controls the collection and use of the personal information. So eventually, the responsibility and accountability for mandatory notification falls with the personal information controller. So if an EMR company is aware of a breach, you should aware the PIC, and the PIC would take the next steps if it needs to inform the data subjects or the NPC.
Okay, that clarifies. Thank you.
Okay. Any
Yes,
further
sir. Thank you.
questions, Ms. Gabby?
Yes, I apologize. We're a bit over time, but I would just
Okay.
like to read here one question, sir. So I noticed in all training hospitals that I've been to so far that the consultants require their trainees or interns or colleagues to send patient health information and other healthcare data via modes like Messenger and Viber to communicate patient management. What are the factors or policies that are lacking that contribute to the lack of secure access of data from patients to providers? And oftentimes, the responsee gets the sender of the question. So this is Dr. Thomas Reyes po, UPM SILab. Institutions would prefer handwritten clinical data so that they would not have to face the complexity of cybersecurity and Data Privacy Act instead of solving the lack of accessibility of patient data.
Okay, so can you go back a bit? So you're saying that they're using
Um,
third-party solutions like
social,
Messenger to
yes.
send what?
Um, patient health information po or healthcare data po.
Okay, so first and
Siguro yung mga
foremost,
charts.
the thing is, I think when it comes to third-party communication channels, or particularly those in social media like Messenger, which is attached to Facebook, I think there was already a Supreme Court ruling on that, is that there is no reasonable expectation of privacy when it comes to communications or social media posts involving these kinds of platforms. So I don't recommend sending those kinds of information or data which contains personal information and sensitive personal information through those kinds of medium. Because aside from the fact that they may not necessarily end up viewable by only those who intend to use that, uh, they end up on various third-party servers. And thirdly, those third parties, those are not infrastructure that are actually you are managing. So basically, you're outsourcing the transfer or the transmission of data to another party. So I wouldn't necessarily recommend that approach. I understand that it is often relied on for purposes of convenience, but there are ways to mitigate that risk. So, for example, you can avoid using social media platforms that you can avoid the communication channels that are based on social media platforms. For example, Messenger. You can rely on messaging platforms that have encryption capabilities. For example, there's WhatsApp, there's Viber. But if you really need to do this, you have to establish the guidelines early on, and you have to have your appropriate privacy notices. that you will inform the appropriate data subjects that we may be transmitting your data using these kinds of channels. So at least you're complying with the Data Privacy Act. At least you are practicing transparency. That you're informing them that you are communicating, you're sending their information through these kinds of methods. Is that the most secure? No. But if you're looking at it from a compliance perspective and from a practical perspective, at least you are compliant with the Data Privacy Act if you do the transparency, if you do your privacy notices, and at least you can mitigate some of the risks. The problem with social media or different kinds of posts is that oftentimes these are groups. So if you are sending data, you're sending, let's say, electronic medical record, it's not just one person who receives it, but the entire all of the members of the group chat who can actually receive that, and that shouldn't be done, because again, we're looking at confidentiality, that data should only be accessible to only those who are authorized to view it. So to come up with a more clear answer to that, we need to do a privacy impact assessment or security risk assessment, but basically that's a quick answer for that. So
Thank you,
Gabby?
sir. Very comprehensive answer. And I believe one final question, sir, before we wrap up this Q&A
Sure.
session. So how often does the ICT conduct cybersecurity checks, such as penetration testing? And what happens when a facility fails? This checks, or are there any sanctions po when a facility failed the check?
Well,
Over.
to be perfectly honest, I'm not familiar with what do you call this, penetration tests done from the DICT. I think you can request it from them. My experience is more on penetration testing with third-party providers. There are a lot of companies which actually specialize in this. Now, the thing about penetration testing, don't look at it as a tool to punish non-compliance. It can actually be used in that respect, but that is not the main purpose of penetration testing. Penetration testing is essentially a security risk assessment to determine how robust or how secure your systems are. So the main point of a penetration testing is that it will provide to you a documentation of the weaknesses of your system so you can strengthen your weaknesses. So do not focus on the results of a penetration testing as potential documentation for any violations on your part, because even the most well-defended organizations, sometimes they also fail penetration testing. Penetration testing is actually more of a technical exercise because it looks at the strength of your technical controls. So do not focus on the aspect that it may be evidence for non-compliance, but look at it as a test for the effectiveness of your system, of your security measures. So that's it, Gabby. Anything else?
Yes. Thank you, sir. I think that ends our Q&A session. And I would just like to read a comment here from Sir Angelo Noel Manuel. Thank you for sharing your knowledge. It will be helpful to my personal growth. Dear, uh, it will be helpful to my personal growth. So congratulations to all the organizers for a successful webinar. And I'm so proud, and I'd like to enjoy your webinar today. And here's a comment also, sir, or a suggestion that there should be a standardized playbook for cybersecurity for enhancing the cybersecurity posture of Philippine health setting and ensuring the safety and privacy of patient information. And this is from Sir Rodel Balingkit. Thank you so much, everyone, for your insightful contributions. Let me just share back my screen of the Q&A session. Now, I would just like to invite over UPM SILab convener, Dr. Alvin Marcelo, to present our Sir Ronald. Sir Dr. Alvin, over to you po.
Thank you, Gabby. Thank you, Ron, for the
Are
very,
you
very
able to
insightful
share
presentation. I think we're starting a movement here.
on your
We
camera
start.
po ba, Doc Eloy?
Sorry, my internet connection might be slow. Um, I'm happy to present the certificate of appreciation to Mr. Ronald Allan Pablo for his exceptional commitment as a resource speaker during the UPM SILab webinar series, Protecting Patients in the Digital Age, Cybersecurity in National Health Systems, given this 25th day of June, held online via Zoom. And Ron, I think we should have more sessions because the community is very excited and very eager to protect themselves.
Mm.
Thank you very much. Signed, Alvin Marcelo, Eva Cochonco, and Arturo Onqueco.
Thank you, Doc Eloy.
I apologize. I got disconnected. I think the internet connection is not very strong today. So now, okay. This session, may I invite everyone to please turn on their cameras. Let's have a group photo. And hold on, let me just check the gallery mode. Ready? In 3, 2, 1. Bye. Okay, so that brings us to the end of today's session, Protecting Patients in the Digital Age, Cybersecurity and National Health Systems. Thank you again, Sir Ronald. And of course, thank you all for joining us. Remember, in today's interconnected world, cybersecurity is not just an IT issue, it's a personal responsibility. And since it's the last Wednesday of June, I want to take a moment to wish everyone a very happy Pride. So let's carry the spirit of inclusivity and safety, not just in our digital lives, but in all aspects of our communities. Once again, this is Gabby Velasquez. Magandang gabi, magandang umaga sa lahat. See you next week. Bye! Thank you, everyone.